Comme il est 2h30,
It being 2:30, the House will now proceed to the consideration of private members' business as listed on today's order paper.
orders of the day.
Private members' business. Consideration at report stage of Bill S-211, National Sickle Cell Awareness Day Act, standing in the name of Mr. Fisher.
There being no motions at report stage, the House will now proceed without debate to the putting of the question on the motion to concur in the bill at report stage. Mr. Fisher, seconded by Ms. Cesar Chavez, moves that Bill S-211, an act respecting National Sickle Cell Awareness Day, be concurred in at report stage. Plaît-il à la Chambre d'adopter cette motion?
Is it the pleasure of the House to adopt the motion? Carried.
Quand ce projet de loi sera-t-il lu une troisième?
When shall the bill be read a third time? Now? Now.
Troisième lecture et l'adoption du projet de loi.
Third reading and passage of Bill S-211. Mr. Fisher, seconded by Ms. Cesar Chavez, moves that Bill S-211, an act respecting National Sickle Cell Awareness Day, be now read a third time and do pass. Debate.
The honourable member for Dartmouth Cole Harbour.
Thank you very much, Madam Speaker. I am proud to rise again today to speak to Bill S-211, an act respecting National Sickle Cell Awareness Day. Bill S-211 seeks to establish June 19th as National Sickle Cell Awareness Day, bringing Canada on the same level and in line with international organizations like the United Nations, African Union, and the World Health Organization, all which consider June 19th as World Sickle Cell Day. Bill S-211 has been wholeheartedly supported by all members in this House and all senators in the other place. But no person has championed Bill S-211 more than Senator Jane Cordy of my home riding, Dartmouth Cole Harbour. Senator Cordy is a strong advocate for Canadians and has brought the voices of those affected by sickle cell disease to Ottawa. Senator Cordy understands the strength of awareness. We have the ability in this House and in the other place to bring Canada-wide awareness to sickle cell disease. Senator Cordy was back in Nova Scotia last week, and during a speech at a sickle cell workshop, she said, and I quote, "My fervent hope is that when S-211 passes, it will provide the opportunity for Canadians, and especially those at all levels of government, to learn about sickle cell. The more we know about an issue, the more power we have to make change. Whether that change is creating policies and laws or changing our understanding," end quote. So in the spirit of that quote, I'll do my best here to make sure that all members here in this House understand what sickle cell disease, also known as sickle cell anemia, is and what it means to be affected by it. Most folks out there, if you ask them, probably wouldn't know what sickle cell disease was. It's a disease affecting approximately 5,000 Canadians and their families. The number of Canadians diagnosed with the disease continues to increase, and the Sickle Cell Association of Canada now estimates that 1 out of every 2,500 children will be born with this disease. Sickle cell is the most common genetic disease in the world. Sickle cell refers to the presence of abnormal hemoglobin resulting in crescent-shaped red blood cells. Unlike normal donut-shaped red blood cells, sickle cells struggle to move easily throughout the body's circulatory system and struggle to deliver oxygen to the organs. Sickle cells have a very limited lifespan compared to healthy red blood cells. The diseased sickle cells become stiff and break apart as they die, clogging the vessels and starving the body's ability to deliver oxygen to its organs. As the organs are starved for oxygen, patients experience extreme pain, especially in their bones. I was reading an anonymous Q&A with a sickle cell patient the other day, where one participant, a young person, explained the nature of sickle cell pain so vividly. It really put the nature of the illness into perspective, and I'm going to share it with you now, Madam Speaker. And I'm going to quote, "You know the way the sky and the atmosphere changes gradually just before a major storm? That's how I feel my body changing just before an onset of pain crisis. It sucks knowing that it's coming and there's nothing you can do about it. When the pain hits you, it takes everything away from you. You have no thoughts, desires, knowledge of anything, and everything within you is focused on trying to get rid of the pain. And then the pain takes over completely. It might just be your arm or your feet or hips or chest, but it chokes the life out of you, literally. The strongest painkillers don't really kill the pain. It only keeps it at bay and temporarily stops it from choking the life out of you. I'm sure you've noticed the labored breathing just before the pain relievers take effect. It's not for show. You struggle to breathe and to live." End quote. Madam Speaker, most of these people are experiencing lifelong debilitating pain. Some people affected by sickle cell anemia are confined to their homes, requiring around-the-clock care. And many folks with sickle cell are receiving regular blood transfusions and are taking pharmaceuticals to manage chronic pain. Numerous blood transfusions are not uncommon for someone with this disease. Madam Speaker, this speaks to the importance of donating blood. Canadian Blood Services calls donating blood giving the gift of life, and it couldn't be truer. By donating blood, you could be giving someone who suffers with sickle cell disease a longer lifespan. This disease primarily affects those with diverse ethnic backgrounds: African, Caribbean, Mediterranean, Middle Eastern, South American, and South Asian. In Canada, sickle cell disproportionately affects members of the African Canadian community. Some time ago, I met with the Black Health Alliance and learned that Black people are overrepresented among people with illness. I learned that discrimination could be one of the major reasons why sickle cell anemia lacks awareness. And that lack of awareness results in individuals being underserved by the medical community. I've heard loud and clear from folks like my friend Rugi Jallo, president of the Sickle Cell Disease Association of Nova Scotia, the discrimination those patients with this disease experience. This disease can be debilitating and obvious, or debilitating and hidden. We have folks like 16-year-old Canadian Adenyi Omishore, who says, "This disease is very limiting, and many on the street look at me weirdly. There are kids in school who even make fun of me." Contrasted by this anonymous statement by a Canadian sickle cell disease patient who said, and I quote, "A good hospital stay is whenever I'm not perceived as a drug seeker or a junkie. A 20-year-old Black kid asking for heavy doses of narcotics always triggers an alarm. I've been refused care many times because of this." End quote. Mr. Speaker, this shows the importance of increasing sickle cell disease awareness across our country. Awareness for all healthcare providers to recognize and understand this disease, and the importance of recognizing discrimination and how it affects people with sickle cell. Time and time again, when learning about this disease, I've heard that folks have gone to the hospital for care only to be turned away and treated as a junkie looking for a fix. To be turned away at the emergency room because they may appear to be an addict and not someone in major pain, Madam Speaker, we must do better. There are organizations across the country working hard to raise awareness. The Sickle Cell Disease Association of Canada remains focused on building awareness of sickle cell disease. They're working to enhance methods of identification, diagnosis, and treatment. They also partner with universities and researchers to help towards a cure. The Sickle Cell Foundation of Alberta is doing great work by helping patients deal with the condition and helping improve their quality of life. In Quebec, the Sickle Cell Anemia Association is working to raise awareness among at-risk groups of this disease. They're promoting research and education and working to support sufferers and their families. The Sickle Cell Association of British Columbia, led by Adobe McAllister, is working on an education handbook for sickle cell patients to help better inform them of treatments and to help handle their concerns. And the Sickle Cell Association of Ontario educated the community about sickle cell and aims to reduce the incidence of sickle cell within at-risk communities. Their initiative on poverty deserves recognition also, Madam Speaker, as chronic illness and poverty often go hand in hand. And as I mentioned, in my home province of Nova Scotia, the Sickle Cell Association of Nova Scotia, led by Rugi Jallo, is working hard to support individuals with sickle cell and their families financially and morally. I've met with this society and I was blown away by their incredible advocacy. I will admit that before our meeting, I knew very little about this disease. The Government of Canada recognizes the importance of rare disease research and has invested $92 million since 2010. Close to $1.3 million has been spent on sickle cell disease research. Yet there are still Canadians out there who are living undiagnosed with this disease. And many Canadians have no idea that they carry the sickle cell trait. Those who are hereditary carriers of the disease who don't suffer any symptoms, their children, unfortunately, have a 50% chance of inheriting the sickle cell trait and a 25% chance of inheriting the disease. These are frightening statistics, and they speak to the importance of raising awareness. And I firmly believe that as a country, we can and will do better. There are provinces that are doing it right by automatically screening newborns for diseases like sickle cell, but many still do not. We have a nationwide patchwork of testing programs which are leaving Canadians with diseases like sickle cell undetected. Canadians are slipping through the cracks. Madam Speaker, this matters. If left untreated, sickle cell anemia not only leaves people with extreme pain, it can lead to organ damage, failure, and even death. If you leave here remembering one thing that you can share with your constituents today about sickle cell, I hope you'll remember the importance of screening. We must encourage the screening of young children who are moving to Canada from countries with substantially higher risk of having sickle cell. And we must screen all newborns in Canada for this disease and its trait. No one should go undiagnosed in Canada with this disease, and no one should go untreated. The earlier we diagnose, the better outcome for individuals to lead a normal life. Yes, Bill S-211 is an awareness bill, but awareness and understanding often lead to more research and less discrimination. For example, on the Sickle Cell Awareness Group of Ontario's website, Doreen Alexander wrote, "As a nurse," and I quote here, "as a nurse, unfortunately I have heard the cries of many sickle cell patients who are often misunderstood or dismissed by healthcare professionals while in desperate need for support." End quote. Greater awareness could lead to more understanding and better training across Canada for healthcare staff. The more people who know and understand this condition could mean better, more supportive healthcare. And stronger research matters to sufferers of sickle cell disease. Every day, researchers are learning more and more about this debilitating disease. I've heard that doctors in Alberta are making progress with stem cell research and transplants, but we must continue to do more. Madam Speaker, I'd like to thank all of my colleagues throughout the House for listening to me speak today about this and for their support, both past and continued, for Bill S-211. And I ask all members in this House to continue supporting Bill S-211, an act respecting National Sickle Cell Awareness Day. Let's send a strong message to those who suffer with sickle cell that we support them, that we believe in stronger awareness for this disease, and that we hope greater awareness will keep sickle cell top of mind among our best researchers and healthcare providers. Madam Speaker, thank you.
Questions et commentaires. The honourable member for Sarnia-Lambton.
Well, thank you, Madam Speaker, and I'd like to congratulate the member opposite for bringing awareness to this important issue. And my question has to do with the association that promotes sickle cell awareness. Do they have specific asks of the government in terms of many of the things you've mentioned, like research and so forth? And could you elaborate on what those asks are?
I wouldn't know that, so I would just say that, the member is to address the question to the chair. The honourable member for Dartmouth-Cold Harbour.
Thank you very much, Madam Speaker, and thank you very much to my honourable colleague from across the way, from Sarnia-Lambton, for asking that question. We met with the Nova Scotia group, and at that time, their focus was on the awareness bill. That's where they wanted to put their emphasis. There is research going on for sickle cell, and a fair bit of it. Putting more focus on sickle cell specifically will drive more research towards finding a cure. Stem cell research is new on sickle cell. It's exciting. It's possible. Right now, sickle cell patients have to do blood transfusions in order to extend their life expectancy. That's just not good enough. You can have a life expectancy of 40 or 50 years with sickle cell, and you can extend that with blood transfusions, but can you imagine up to 10 to 20 blood transfusions a month? I think that stem cell research is the direction that I think researchers are looking towards right now. And like I said, there were $1.8 million, I believe, focused directly on sickle cell research, but more can be done. Thank you.
Questions et commentaires. Questions and comments. The honourable parliamentary secretary.
Thank you very much, Madam Speaker, and I'd like to really give kudos to my colleague from Dartmouth-Cold Harbour for championing this bill and bringing it forward. And as someone who lives with sickle cell trait, I'm wondering if he could really expand on what is necessary to ensure that people are aware that they have the condition. I knew I had it, so when I found a partner and had children, I was able to do the test. But how important is it to ensure that people are aware of their condition and are therefore able to address it as they are finding a life partner and having children?
The honourable member for Dartmouth-Cold Harbour.
Thank you, Madam Chair, and thank you so much to my colleague for the question. I will say, though, that the true champion of this bill is Senator Jane Cordy, who brought forward a private member's bill in the Senate prior to the election being called in 2015, and it died on the order paper, and then brought it back again after the election. So she's the true champion of this. She's the one that has pushed this from the start, and she deserves the credit for this bill. And she's from the wonderful riding of Dartmouth-Cold Harbour, so it's always great to combine the two of us. But the number one thing that we need to ensure is that we have newborn screening. Absolutely so important, so that you can, when you have that diagnosis of whether you carry the trait, or whether you're going to have the disease or have the sickle cell disease, it's so important to know from day one what kind of treatment plan is out there. There are examples of young people up to 20 years old before they find out that they have sickle cell. They've gone through 20 years of excruciating pain. The way that they would manage their disease is totally different if they were screened at birth and knew in advance. Thank you, Madam Chair.
We have time for a brief question. The honourable member for Vancouver Kingsway.
Madam Speaker, in 2006, the WHO, of which Canada is a member, adopted a resolution urging support for sickle cell disease research. 10 years later, I'd like my honourable colleague to maybe inform us, has any progress been made in Canada on this recommendation?
The honourable member for Dartmouth Cold Harbour.
Thank you very much, Madam Chair, and thank you to the honourable member for the question. We're behind on deciding that we're going to name June 19th as World Sickle Cell Day or Canada Sickle Cell Day. This is something that we should have done back in 2006 or 2008 when the UN declared it as well, but there's no time like the present. This June 19th coming, I expect, will be the first National Sickle Cell Awareness Day in Canada, and I'm looking forward to that. And I hope that it brings the awareness that drives us further to push research in a direction that will benefit the Canadians and those in the world that suffer from sickle cell. Thank you.
Reprise de débat, resuming debate. The honourable member for Sarnia-Lambton.
Well, thank you, Madam Speaker. It's a pleasure to rise in the House today to speak in favour of Bill S-211, an act respecting National Sickle Cell Awareness Day. This bill seeks to designate June 19th as National Sickle Cell Awareness Day in Canada. This is in line with many international groups who have also recognized the importance of raising awareness for this terrible disease. These entities include the African Union, the World Health Organization, and the United Nations, who attributed this day to sickle cell disease in 2008. Now, there was a time when I was unaware of what went on in terms of the creation of these days and the benefit thereof. But since I've come to the House of Commons, nearly every day we have something that's presented as an awareness day for this topic or for that topic. And there's so much information that's presented. I've learned so much about the different needs of people suffering with various illnesses or people that are supporting different causes. And so I think there's a lot of value in bringing forward and celebrating such a day when this kind of information can be brought to bear and the government can be informed of what the needs are in order to eradicate this terrible disease. Now, today is not the first time that sickle cell awareness has been brought before this House. A Nova Scotia senator brought a similar bill forward in early 2015, and the same topic was also brought forward in passing in Bill C-605 by the current Minister of Science in 2010. Designating June 19th as National Sickle Cell Awareness Day would not give holiday status to this date, but it would be used as a tool nationwide to raise awareness of this disease, not only in this House, but in schools, workplaces, and dinner tables across the country. For these reasons and many more, I would join my voice to those of my colleagues across the House and in the other House in favour of Bill S-211. I would like to use my time today not only to show my strong support of this bill, but to do everything in my power to educate Canadians on this little-known disease. La drépanocytose.
Sickle cell anemia is a disease that you have at birth. It's caused by abnormally shaped cells rather than O-colored. Hemoglobin, for those living with sickle cell anemia, looks more like the letter C as opposed to the letter O. It almost looks like a tool that is used for agriculture, like a scythe. Hemoglobin is responsible for transporting oxygen and is essential to the functioning of vital organs. When you have sickle cell anemia, your red blood cells end up causing blockages in veins. Regular red blood cells can live up to 120 days, but sickle cells can only last up to 20 days. This rapid deterioration of cells often leads to anemia.
Registry in Canada, it's estimated that approximately 5,000 Canadians live with sickle cell disease today. In the United States, the number is close to 100,000. Worldwide, sickle cell disease affects almost 100 million people. However, many Canadians do not know the symptoms, effects, or treatments related to this painful disease. Sickle cell disease causes complications in two ways. First, the breakdown of red blood cells at a rapid rate, and second, by the blockage of blood flow in vessels. Both of these problems can cause immense pain, especially in the bones. Sickle cell disease can also lead to a whole list of other complications, including damage to the liver, kidneys and heart, infection, chest pain, acute joint pain, blindness, stroke, and it can also cause irreparable damage to major organs, going so far as heart failure. This multi-system disorder has also been known to cause premature death. Sickle cell disease does not have a cure. However, it is treatable, and I'd like to recognize all the medical professionals and caregivers who treat and support those who live with sickle cell disease across our country. Simple lifestyle changes have been shown to make a tremendous difference in the disease, and those living with sickle cell disease are encouraged to exercise regularly, eat a healthy diet, and reduce the amount of stress in their lives. In fact, I think we could all benefit from doing those three things. Many complications can be prevented or treated through regular blood transfusions and through powerful medication. Those living with sickle cell disease routinely have between 10 and 20 blood transfusions every month. And as such, I want to encourage Canadians to donate blood whenever possible. Il s'agit d'une maladie.
This is a disease that exists throughout the day, throughout one's life, and we have to do more to draw attention to the way in which this disease affects Canadians, as well as to the necessity of doing more research and data collection. Many have said that education is the first important stage, and that if we have a National Sickle Cell Awareness Day, then that is an important step. Screening for sickle cell anemia is available. However, they're not very well known. Because sickle cell anemia is hereditary, it's even more important for those who want to have a child to do this screening. Universal screening for sickle cell anemia is now available in all American states. And in Canada, this test is available upon request in Ontario, British Columbia, the Yukon, New Brunswick, Prince Edward Island, and in Nova Scotia. Screening is available in a limited number of hospitals in Quebec, and in the future, this test will be available to all. When a child is born with sickle cell anemia, one doesn't know what kinds of complications will develop over their lifetime. For the first 6 months of their lives, high levels of hemoglobin often cause most of the complications. After that, complications develop very quickly. Infection is the highest concern amongst children living with sickle cell anemia. The World Health Organization recognizes that sickle cell anemia is one of the main causes of death for children under 5 years old. So we have to do more for screening, awareness raising, and education. Those should be an important part of our health system.
In my speech, it's so important that we bring awareness to this disease, that we do research into how we could prevent the disease or reduce some of the terrible effects that this has on different organs in the system, that we support those who are both experiencing the disease as well as those who are caregivers of those who have the disease, and that we share with our global partners. As I said, we have only 5,000 perhaps in Canada that have the disease, but there are millions around the world, and there is research that's happening around the world. We need to be at that research table. We need to be collaborating together, because together we have seen Canada leads when it comes to medical health research, in bringing solutions in vaccines, in bringing solution to disease, to many of the things like brain complications. Canada is a leader. We can contribute, but we also need to work with our partners around the world in order to have a big enough population to learn how do we come against this disease. So in closing, I'd like to thank the sponsor for the bill and encourage all my colleagues from this House to join me in support of those living with sickle cell disease and in support of those who care for them, with groups like the African Union, United Nations Educational, Scientific and Cultural Organization, and the World Health Organization. I want to recognize June 19th as Sickle Cell Awareness Day. I believe Canada should take this step in the right direction and raise awareness for this important cause. Thank you, Madam Speaker.
The honourable member for Vancouver Kingsway.
Thank you, Madam Speaker. Well, as the health critic for the New Democratic Party, and on behalf of my colleagues in the NDP caucus, I'm proud to stand today and express our support for this bill as well, which would declare a special day to commemorate National Sickle Cell Awareness Day and to bring attention to this very important condition. Now, sickle cell disorder is the most common genetic disease in the world. The WHO estimates that sickle cell anemia affects nearly 100 million people on the globe. Canada's first recorded case was published in 1966. In 2016, some 50 years later, it was estimated that between 5,000 and 7,000 Canadians live with sickle cell disorder. In 1978, it was discovered that the gene responsible for hemoglobin is on chromosome 11. A prenatal genetic test for sickle cell disease was developed in 1980. To be affected, an individual has to receive the defective gene from both parents. If only one parent passes on the defective gene, that individual will be a carrier but not affected. If both parents are carriers, there is a 1 in 4 chance that the child will be affected by this disorder. Now, fortunately, sickle cell anemia can be detected before birth, and couples who are both carriers may wish to consider prenatal testing for the condition. Sickle cell disease is more common among those whose ancestors come from certain parts of the world, including India, the Middle East, and from sub-Saharan African, Caribbean, and Mediterranean countries. However, it's very important to note that contrary to some common misunderstandings, that sickle cell disease has no color, because it also affects Caucasians from Europe and elsewhere. So getting all Canadians tested will be the best way to move forward. Now, sickle cell disease is characterized by a mutation in the shape of the red blood cell from a smooth circular shape to a crescent shape, which can result in the blockage of small blood vessels and the impairment of blood flow. This leads to a reduction in red blood cell survival and subsequent anemia. A sickle-shaped cell has a lifespan of only about 20 days, unlike a healthy cell with a lifespan of 120 days. Now, the problem of clogged blood cells and low blood count hampers the body's ability to bring oxygen to the organs. This starvation of oxygen most commonly manifests itself as severe pain in the bones and can damage shoulder and hip joints in particular, or cause chest pain. There can also be damage to the lungs, heart, liver, kidneys, and eyes. The poor blood oxygen levels and blood vessel blockages that result from sickle cell disease obviously then can lead to severe chronic pain, serious bacterial infections, and tissue death. The symptoms of sickle cell anemia can vary widely in number and severity. However, the most common symptoms are related to anemia and pain. Other symptoms are related to complications from those. During painful crises, medications can reduce pain and help avoid complications, and extra fluids can prevent dehydration. Oxygen can be provided if there is not enough in the bloodstream. When anemia is severe, blood transfusions may be used to treat and prevent complications, and antibiotics are frequently administered when there are consecutive infections. The lifespan of persons with severe sickle cell disease can be reduced by as much as 30 years. Currently, there is no cure. At this time, the only treatment options are to relieve symptoms by treating vaso-occlusive crises, preventing triggers, and administering blood transfusions to prevent anemia, and exchange transfusions to reduce hemoglobin S in the blood. Gene therapy is also being studied and holds some promise. Now, many people with this condition are in reasonably good health and can live productive lives into their 50s and longer. Some people, however, develop severe symptoms and complications and require frequent hospitalization. The broad range of sickle cell disease symptoms may cause healthcare professionals to misdiagnose the condition. Now, in Canada, 6 provinces and 2 territories provide prenatal screening right now: Quebec, Ontario, BC, Yukon, Nova Scotia, New Brunswick, PEI, and Nunavut. Right now, Alberta, Saskatchewan, Manitoba are currently considering prenatal screening. So while recognition of June 19 of each year as World Sickle Cell Day is important in order to promote awareness among Canadians of the disease, and this act is a good start, it is not enough. We need more. Since this disease can place a substantial burden on family members, better support is needed for caregivers, particularly the parents of children with the disease. Support for access to screening of newborns and the genetic screening of adults at risk who wish to have children, and improvements for diagnosis and treatment are long overdue. Special awareness and communication plans for ethnic groups at risk are also important. Canada is, of course, one of the most diverse countries in the world, and many Canadians trace their roots to the Caribbean, Sub-Saharan Africa, India, the Middle East, and the Mediterranean, regions where, as I've already pointed out, the SCD gene is more common. We also need international cooperation and assistance to respond to requests from the WHO in a resolution adopted by the Assembly in 2006 to help the most vulnerable groups identify and treat individuals with sickle cell disease. Now, I think this is where I think all parliamentarians ought to be directing our attention after hopefully every parliamentarian votes in favor of this bill, and that is, it's not enough just to commemorate and recognize a disease. What's important in terms of government policy and what Canadians, whether they are at risk for SCD or not, expect from this government is action. And we need to start seeing some real meaningful resources devoted not only to SCD but also to other genetic conditions. And I think that Canadians want this Parliament to do everything that we can to increase spending in research and treatment so that we can make the scientific and medical breakthroughs and inroads that are needed in order to actually find a cure for this condition and others like it. Madam Speaker, I think health professionals need a special shout-out in terms of any bill before this House that deals with the healthcare field. Healthcare professionals are, of course, on the front lines of this disease and all others, and we have to recognize the work that they do in, I think, what most Canadians would feel is the most important aspect of their lives, which is their health. I know that many healthcare professionals, though, because of the relative rarity of this condition, are unaware of this disease, and especially because of its uneven prevalence across the country, particularly in rural areas. So healthcare professionals in particular need to be better informed about the prevalence of at-risk populations and the risk of misdiagnosis. We've heard other speakers in this House already talk about the fact that people can present at hospital or emergency rooms with indicia that don't necessarily present as sickle cell disease, and in fact are often misdiagnosed, sometimes in very stigmatized fashion. Treatment and testing, I'll deal with testing first, should be available across Canada. And in particular, we must not forget the rural and remote areas of this country, which are often left out of the equation. Treatment protocols and pain reduction strategies should be shared, since early treatment cuts the cost of care and sets out what steps to take. Now, Madam Speaker, I want to focus a little bit on the international situation here, because I think most Canadians want Canada to play a responsible role on the world stage and take our place in proper form and meet our responsibilities, particularly when it comes to health and particularly when it comes to diseases that know no borders, which sickle cell disease does not. So, as I mentioned already, in 2006, the World Health Organization, of which Canada is a member state, adopted a resolution urging support for SCD research. 10 years later, I think it does no violence to any party in this House to point out that we have not made any progress really in that regard. The resolution at that time stressed the urgent need for member states to develop, implement, and reinforce in a systematic, equitable, and effective manner comprehensive national integrated programs for the prevention and management of SCD. Madam Speaker, again, I congratulate my honourable colleague on moving this important bill forward. I think it's going to get all party support to recognize this important day, but let's not leave it there. Let's heed the WHO. Let's do what we can in this Parliament to at least make a good start on fulfilling those obligations that the WHO called for and which Canada agreed to at the time. Thank you, Madam Speaker.
The Honourable Government House Leader has a point of order.
Please. Thank you, Madam Speaker. Madam Speaker, I would like to advise that agreements cannot be reached under the provisions of Standing Order 78.1 or 78.2 with respect to the report stage and third reading stage of Bill C-49, an Act to amend the Canada Transportation Act and other acts respecting transportation to make related and consequential amendments to other acts.
Under the provisions of Standing Order 78.3, I give notice that a Minister of the Crown will propose at the next sitting a motion to allot a specific number of days or hours for the consideration and disposal of proceedings at those stages. Thank you, Madam Speaker.
Resuming debate, reprise de débat, the Honourable Parliamentary Secretary to the Minister of International Development.
Thank you, Madam Speaker, and it gives me great pleasure to stand in this place in solidarity with my colleague from Dartmouth Cole Harbour to support C-211, an act to mark June 19th as National Sickle Cell Awareness Day. Madam Speaker, I also want to acknowledge Senator Jane Corby, who brought this bill forward and was a real champion for this piece of legislation. Madam Speaker, I want to take some time at the outset of my speech to really thank the member from Dartmouth Cole Harbour. As he was saying his speech, he mentioned that he didn't know anything about sickle cell before, and I alluded in my previous question that I live with sickle cell trait. And Madam Speaker, last night was a very difficult evening for me. I was talking to my kids on the phone, and you know, I'm here and they're there. I'm an Ottawa mom, they're Whitby kids, and I kept thinking, you know, how tough it is sometimes to be a mom here. And then I got the opportunity to start thinking about writing this speech, and I thought, where else in the world would you have someone from Dartmouth Cole Harbour who has no idea about this disease meet up with someone who lives with the trait of this disease and be able to work together along with every other member in this place to raise awareness, to do some incredible work and amplify the voice of Canadians who are suffering day in and day out with this specific disease. I cannot thank you enough. I cannot thank Senator Jane Corby enough for your diligent work in bringing this forward. And I'm so proud to be able to be with you to see this go across the finish line. But, Madam Speaker, other members in this House have spoke to the thanks that we should be giving to our researchers and our medical professionals. With this bill and with this day, Madam Speaker, I'm urging those medical professionals and those researchers to continue to ring the alarm around this condition. We have heard people in this House speak about the tremendous pain that individuals go through when they appear at the hospital looking for help. These are oftentimes very young children who appear to a hospital with excruciating pain, and they, of course, are asking for pain medication. So the automatic dial is set to this person is an addict. And I'm urging healthcare professionals and researchers to continue to talk to your colleagues. Use June 19th as the day that you decide you're going to speak to your colleagues and tell them to turn the dial the other way, to turn the dial in the way that goes towards the compassion and the humanity for the individual, knowing that they may have a condition that you might need a little bit more awareness about, and hence this particular day. So, Madam Speaker, as I mentioned, I live with sickle cell trait. I really don't have any symptoms of the disease. I go through my normal life pretty much fine. But as mentioned, this disease affects individuals of the Mediterranean community, of the Middle Eastern community, South American, South Asian, but it disproportionately affects members of the Black community. And so it is for these reasons, for understanding that so many different people are affected and impacted by this condition, it is so important for a day like this for a couple of reasons. One is to create that awareness and to continue the advocacy for newborn screening. The fact that it is has a patchwork across the country, thank you to my colleague, across the country really does a disservice to Canadians. And again, we're talking about young people who suffer excruciating pain with this condition. We want to ensure that people who are living with this condition are also able to talk about it. I mean, we heard that they may undergo 10 to 20 blood transfusions per month. They're only 30 days in a month. They spend more than half their time in hospital getting blood transfusion. And at this point, I would like to take a page from both individuals who spoke about this to give a massive shout out to the Canadian Blood Services and encourage people to donate blood, because you're saving, it really does save lives, and you make people's quality of life a lot better, especially when we're talking about this disease. But I'm going to go back to the individuals and their caregivers and families who are living with this condition. I encourage you to use this day and every day to advocate, to talk to your friends and neighbors. My colleague from Sarnia, Lambton, said that it's a conversation that we have in the workplace and at the dinner table. Like, that was so profound, at the workplace, at the school, and at the dinner table. It's such a profound statement, because you don't want this to just be politicians or researchers or doctors or people who cannot, get access to everyday individuals. People who live with this condition use this day to feel empowered to go out and talk and advocate for yourself or for your children. Tell your neighbors, you might need someone to give you a casserole a couple days a month because you're in hospital. I've never had a casserole. I've never made a casserole. I could make you like a macaroni pie or something, but it gives you an opportunity to get together with your neighbors and really do what we do best as Canadians, and that is help each other out. So use this day to speak about it, to not continue to suffer in silence, to not continue to suffer by yourself. And Madam Speaker, I'm not sure how much time I have left, Madam Speaker. 3 minutes, Madam Speaker. 3.5 minutes. Thank you very much, Madam Speaker. I want to also speak to the importance of, again, these individuals in the community speaking to each other. Because imagine, Madam Speaker, imagine everyone in this house, imagine not being in hospital 10 to 20 times a month to get a blood transfusion. What does that do? That decreases your ability to go to school every day. That decreases your ability to get good, stable employment. That decreases your quality of life. And if that happens, I'm just assuming that these individuals need support, that they need a community. They need, as they say, a village to help them in their suffering, in the transition that they have with their family, with their loved one who's going through this condition. So it might be that, a friend from school is able to bring home homework. It might be that you're able to get a hot meal from someone who shares that with you. It might be the fact that you're able to just breathe for 5 minutes because you are taking care of a child who is in exceptional pain. And again, this bill, this day, June 19th, I think will allow parents, loved ones, the reprieve and the respite to be able to say, I need help, I have this condition, my son or daughter, my loved one has this condition. Madam Speaker, before I close, I do want to give special kudos and shout-outs to the organizations that were mentioned by many of us here today, the Sickle Cell Disease Association of Canada, Sickle Cell Association of Nova Scotia, and in particular, Madam Speaker, the Sickle Cell Association of Ontario. Before getting to this place, I volunteered with a young woman in her 90s by the name of Lily Johnson. Lily Johnson is a force to be reckoned with and a staunch advocate for sickle cell disease. She received the Order of Ontario in 2011, the Toronto Public Health Champion in 2009, and was the first Black Director of Public Health. This woman is a tour de force in terms of her advocacy for people with sickle cell. I worked in a research consulting firm. She solicited me to help her get the resources to be able to advocate for research. And to my colleague who mentioned it, we do need continued and exceptional research dollars and funding for genetic conditions. We do need to continue to be that voice, to amplify the voices of those in our community who need our help, to continue to advocate for the funding to ensure that Canadians could live the best possible quality of life. And I'm so happy to stand with my colleague today, and I'm even particularly happier right now to give a shout out to his wonderful daughter Ava, who I think is totally cool. So I'm going to do that right now as well and close with that, Madam Speaker. Thank you so much for your time.
Resuming debate, reprise de débat, and before I recognize the next speaker, I just do want to acknowledge that I will have to interrupt the proceedings during that speech as well. So, the Honourable Parliamentary Secretary to the Minister of Justice and Attorney General. Resuming debate.
Thank you very much, Madam Speaker. And I want to actually begin my remarks by building just a little bit on the remarks made by my colleague from Whitby. Now, I was inspired by her remarks and by her leadership on so many issues, but she made reference to a number of very important advocacy organizations for those who are suffering, for the families of sickle cell. And I think it's very important that we acknowledge their important work. But, Madam Speaker, I'd also like to take this opportunity, if I may, just to bring to attention another extraordinary organization that exists in my city, in the city of Toronto. And it's the organization that promotes a Camp Jamoke. Camp Jamoke is a charity organization that's been operating since 1994. And in that period, now this is an organization comprised entirely of volunteers. They receive no government funding, but they do receive some support from the community. And since 1994, they've organized camps every summer for children in our community suffering from sickle cell anemia. And I just wanted to acknowledge the extraordinary volunteers and the commitment of that organization as well, Madam Speaker, for the great work that they do. And I've had the privilege over the past 2 decades to work and to attend a number of events with this organization and to meet the children who are affected by it. And I think, Madam Speaker, as we deal with this issue and we speak to the idea of declaring a day of awareness, it's very important to always keep in mind those young kids and their families who have been affected by this disease, and to remember those who are working tirelessly in our community to make a difference, to support them. And these kids, because of the nature of their illness and the way in which they suffer, and I'll speak a bit more about that when I get into my prepared remarks, but they miss on average 50 days of school each year. They are unable to participate in so many things that most kids can take for granted. And so the opportunity to spend time with each other, to have an opportunity to go and experience the fun of a summer camp with people who understand the limitations that their health condition places upon them, I think is an extraordinary thing. And so I want to just, again, I'll get to my prepared remarks, but to acknowledge all of the people in our community who are making a difference, Madam Speaker, every day, and to acknowledge those kids for their courage, for their bravery, the way in which they face this terrible disease. And I think it's a great privilege that this House would have an opportunity to call upon all Canadians to keep in the forefront of their thinking those children, their families, and those who support them. Now, Madam Speaker, to my prepared remarks. We welcome the chance to add our voice in support of Bill S211. I want to reassure Canadians living with sickle cell disease that the government and the people of Canada have their support and have got their back. This act respecting National Sickle Cell Awareness Day is a testament to our national commitment to increase awareness of sickle cell disease and to improve diagnosis and treatment as we work to find a long-term cure for those affected by this disease. The sickle cell disease is a devastating disease, Madam Speaker, as I've said, that cannot be ignored. It is diagnosed more than 100 times each year in this country when a baby is born with this rare blood disorder. And as that child is born, they join the other 5,000 Canadians already living with this disease and the hundreds of millions of people like them suffering from around the world. Madam Speaker, these are people who learn to cope with tremendous pain from a disease that to date has eluded a cure. The pain episodes they experience are due to bone marrow necrosis. And these are people, young people, who suffer frequent painful attacks that send them to hospital for blood transfusions and drug therapies in order to manage their disease. And they are individuals far more susceptible to infection and increased risk of stroke and vision loss. Perhaps most alarming, Madam Speaker, these are people that expect to live shorter lives than other Canadians because sickle cell disease can lead to serious bacterial infections and tissue death that can frequently result in an early death. Their life expectancy is calculated to be 30 years less than most other Canadians. Aside from the terrible loss of the loved ones of these individuals, Canadian society as a whole is shortchanged when this happens. First and foremost, we lose the valuable contributions of these individuals to our economy and to our communities. But we also pay the high cost to cover their frequent stays in hospital, an average of $20,000 per week for a one-week stay. And there are generally many more weeks than one. This doesn't begin to capture the debilitating impacts that this disease can have on those individuals living with sickle cell or their families and friends around them. Madam Speaker, few of us can imagine how harrowing a diagnosis of sickle cell disease must be. Yet it is a reality that a significant proportion of the population know only too well. Approximately 5% of the world's population carries the gene for sickle cell, which means it is bound to surface in some Canadian families and communities. And in fact, Madam Speaker, given Canada's multicultural composition, it is sadly inevitable that we will see more babies born with this rare blood disorder. And studies suggest that the odds of a Hispanic person having sickle cell disease is 1 in 1,000, and that jumps to 1 in 500 for those of African ancestry. For a couple to have a child with sickle cell disease, both parents must be carriers. And according to research, when both parents are carriers of the gene, each pregnancy they have has a 1 in 4 chance that the child will be afflicted with sickle cell, and a 1 in 2 chance that the child will be a carrier, even if he does not have the disease. The problem is that people with sickle cell trait often don't know they have it. And as they don't have the symptoms of the disease, even though they can pass this gene for the disease onto their children. And that's why we need all parliamentarians to lend their support to Bill S211. It will create a National Sickle Cell Awareness Day each year on June 19th to promote awareness and to spur action to address this dreadful disease. A dedicated national day will help prospective parents to understand the risks of being a carrier and potentially having a baby with sickle cell. It will also help to increase early diagnosis among newborns to make sure youngsters with sickle cell get the appropriate treatment as soon as possible. And this can prevent complications and improve the child's quality of life. Thanks to earlier advances in diagnosis and treatment, kids born with this inherited disorder can receive the right treatment and support as they grow up to enable them to live active and productive lives. Equally important, Madam Speaker, this National Day will inspire research in their quest for a cure for a sickle cell disease. As the Parliamentary Secretary has noted earlier, some of this country's top scientists are already increasing our knowledge of these disorders and discovering new treatments. For instance, the Canadian Institutes of Health Research is involved in several clinical trials for the treatment of the disease as well as for the treatment of sickle cell-related pain. This work is taking place under the International Rare Diseases Research Consortium, which we have helped to establish. The Canadian Institutes of Health Research also are engaged in international collaboration in rare disease research through eRare. That's the European Union's main initiative to fund research into rare diseases. This collaboration is enabling scientists in different countries to work together on a common interdisciplinary research project. Madam Speaker, these are the kinds of hopeful steps that can be inspired by a National Sickle Cell Awareness Day each June 19th in Canada. Critical steps that will lead to promising results that can improve the lives of Canadians living with this disease. And therefore, I take this opportunity to call on all parties to unleash this potential by supporting the passage of this important bill. Be part of the solution to this perplexing health challenge by standing up for Canadians already living with the disease and by helping to ensure that we protect future generations from it.
Unfortunately, the time is up for the debate, the rest of the debate on this today. The member will have approximately 2 minutes at the next time that this issue is before the House. The time provided for the consideration of private members' business has now expired, and the order is dropped to the bottom of the order of precedence on the order paper.
As it is now 2:11, the House will adjourn until next Monday at 11 a.m. pursuant to Section 24(1) of the Standing Orders.